In this presentation, we're going to be looking at labrum tears. The labrum is found in the glenoid cavity and is made of a fibrous tissue. The point of the labrum is to deepen the socket to add shoulder stabilization and is also the main point of attachment for many ligaments as well as the biceps tendon. The mechanism of injury for labrum tears we typically see is falling on outstretched arms, hyperextension, direct trauma, dislocations, subluxation, and then any type of repetitive shoulder use, whether that be throwing, swimming, etc. Continuing with the mechanism of injury, what we most commonly see is a superior compressive force on the shoulder, such as in the picture next to you, or if we have traction inferiorly. Different types of tears is more like location. So you have posterior and anterior tears, superior, inferior tears, as well as you can have like posterior, inferior, anterior, superior, etc. And there's also two special types of tears called a slap tear and a Bankart tear. A Bankart tear is typically seen in all of our anterior shoulder dislocations and subluxations. It causes a fraying and a tearing anteriorly of the labrum, as you can see right through here. A slap tear is called it stands for superior labrum anterior and posterior. So basically it's the superior portion of the labrum is torn in the anterior and posterior aspects, and a lot of times also involves the attachment or the biceps tendon itself. Slap tears are categorized into 4 different types. You have type 1, which shows some fraying and tearing of the labrum and of the bicep, and some fraying of the biceps tendon itself. Then type 2 is detachment of the superior labrum and the detachment of the biceps from the actual glenoid itself. Type 3 you see is a bucket handle tear, so almost like the picture in the last one, that would be a bucket handle. And then type 4 is also a bucket handle, but you're tearing the biceps tendon with it. There are a few different tests to test labral tears. None of them have a lot of clinical value to them, but if you click in these links below, you can watch them. But the O'Brien's test, you want to know that there's going to be 2 different positions, and so in the first one they should have pain, and in the second one they should have little to no pain in that second position, and that will be a positive sign. The clunk or crank test, you need to make sure that you put the arm above the head around 160 degrees. You want to add a slight anterior glide, and you want to add a compressive force to really push the humeral head into the glenoid itself to where the labrum would be. And then you want to move it around, trying to catch that tear, almost like in the McMurray's click. You're trying to find that grinding or that clicking, or the clunk as they call it. The grind test, you want to have them laying down, and you want it at 90-90, like in the picture here. You want the shoulder at 90, you want the elbow at 90, and you're going to internally and externally rotate, also while adding a compressive force, pushing the humeral head into the socket more. And a positive sign for that is also going to be that grinding, that clunking, the clicking, etc. The PCOD analysis I did, I found a study, and they had 40 patients that all had different types of labral tears, where that would be anterosuperior, antero-inferior, and then posterior-inferior. All of them were athletes in a sport that was using shoulder motions. All 40 of them received this new arthroscopic labral debridement surgery. The comparing was they were going to see the different rates of recovery after the surgery, 1 year and 2 years after that surgery. The outcome is every patient was evaluated at a minimum of 2 years post-op. 7% saw relief of their symptoms after 2 years. 7% of them saw relief of all symptoms. At one point, at 1 year, 72 were seeing improvement, and then they later deteriorated, proving that this arthroscopic labral debridement was not an effective long-term care, as it provided immediate response that killed the symptoms, but long-term, all of them came back. And then the time, of course, was a minimum of 2 years, but the average is about 43 months for each patient. And those are my citations. Thank you for listening to my presentation.